Good afternoon, everyone. Hi, I'm Joan Winsenson. I'm the Executive Director of Conquer Myasthenia Gravis, and welcome to this afternoon's webinar. I should tell you too, I miss seeing you in person, but we're glad you're here today. Today we're addressing telemedicine and MG. We'd like to thank our sponsors for their support. And we'd also like to remind you that each person's experience is unique. And this webinar is not a substitute for medical advice. We'll be hearing from Dr. Rabia Malik. She's a neurologist and an assistant professor at Rush University Medical Center. She has a wealth of experience in treating MG patients, and she's also done research with MG. So what you'll see first is her presentation. It's about 30 minutes. Then she's going to address questions. We've gotten a number of questions in advance, but if something occurs to you while you see the presentation, there should be a question box in your control panel, and you'll be able to, you can type a question in there and just hit send or hit enter, and it'll come to us, and we'll address it at the end. So let's get started.
Hello, everyone. My name is Rabia Malik. For those of you who don't know me, I'm a neuromuscular physician at Rush University Medical Center. I serve as the director of the MDA Care Center here, and I'm also the director of the EMG lab at Rush University Medical Center in Chicago. Today I will be discussing how telemedicine can be helpful for seeking healthcare, especially for myasthenia gravis. But before I begin, I just wanted to point out that there are two terms that we use, telemedicine and telehealth, and we tend to use them interchangeably, but there are some differences. So when you think about telemedicine, it's more has a more narrow definition and applies to a remote clinician-patient interaction. When you think about telehealth, that's more of an umbrella statement, and it does not always involve clinical services. So it's a broader term, and it can be healthcare delivered by an allied healthcare professional. So it could be your physical therapist and your occupational therapist. It can also be provision of online educational resources and even conducting of support groups. So that would all follow under or fall under telehealth. For the purpose of this talk, I'll be limiting myself mostly to telemedicine. All right, in December of 2019, the novel coronavirus outbreak began in Wuhan, China. Since then, it's spread very rapidly and has touched all parts of the globe. The WHO, the World Health Organization, declared the virus a global health emergency towards the end of January of 2020. This is a screenshot that I took from the CDC website. That's the Center for Disease Control. And I took this last week, August 5th, at around noon, and these numbers are already outdated. We're looking at over 4.5 million confirmed cases in the USA of COVID-19. And in Illinois, there are over 180,000 cases. Unfortunately, we're still in the midst of the pandemic. It's not over yet because we're still seeing new cases. Because of the limitations in place, especially for patients who have underlying medical diseases and illnesses and are on immunosuppressants, who may be considered high risk for acquiring and getting very sick from COVID-19, there are some measures in place to allow for social distancing to reduce exposure and infections. And in mid-March of 2020, in response to the COVID-19 pandemic, the US Congress approved emergency use of telehealth services. This allows patients to seek care from the comfort of their homes. And in the last few months, we've seen a explosive expansion of use of telemedicine and telehealth. So it's important for all of us to get comfortable with using virtual care. So by the end of this presentation, I want you to feel comfortable with use of virtual care. And I want you to be, have these tips with you that will ensure that you have a very effective and efficient virtual visit. But at the same time, I want you to understand that there are some limitations of video visits, and we'll go over some of those. So with that sort of overarching objective, I will talk about how to prepare for your video visit. There is such a thing as a virtual neurological exam. So many of you are very comfortable with the neurological exam. So when you come to the clinic, the neurologist will put you through a series of tasks to try and understand different parts of the neurological system. With myasthenia gravis, of course, the most important system is the motor exam, so the strength of your muscles. And so that's done by what we call confrontational testing, so your strength against my strength. But there are some things that we can do successfully virtually, and I'll talk a little bit about that. We'll talk a little about some advantages of telemedicine. And then lastly, I'm going to touch upon some scenarios where a video visit may not be enough. Okay, all right, so preparing for your visit, this is key. So before the visit even begins, here's your checklist. This is what you need. You need your smartphone or your tablet. Make sure it's fully charged, and if it's not charged, make sure it's connected to a power source. You could use a laptop or a desktop with a camera option, but in my experience, a number of apps are not supported very well on desktop. So the experience is a little bit easier and more efficient if you're using a smartphone or tablet. But having said that, desktops can be used effectively. The key is to do this in advance. Of course, you need internet connection, and then you need instructions from your healthcare provider's office. And they'll tell you how to download the app on your phone or on your tablet, and the app is usually free, and they'll tell you how to access your visit. So this is setup. Setup needs to happen a few days prior to your clinic visit, especially if it's your first time using virtual visit. It's important to sign into your patient portal or app a few days in advance to make sure that your login information is correct and you haven't forgotten your password. And if you have, you try and troubleshoot it in advance of your clinic visit. The appointments can be accessed through a link that's sent either via a text message to your phone or is sent to you in an email. So all you need to do is click into the link, and it will kind of go through the process of connecting you to that virtual visit. If you're using an app, and each app is a little bit different, so I'm not going to go into too many details with that, but you can kind of, there's a section in the app where you can view your upcoming e-visits, and you just need to go into that and you can get a list of what's, what time is your next visit, and if you just click into that, you should be able to connect. So do this in advance, do this a few days in advance of your clinic visit, especially if it's the first time you're using it. And then remember, the clinic staff is there to support you and to help you. So if you have any questions, feel free to call the office and have them help you kind of work through the app. You can have a family member be present for tech support. And it's sometimes very helpful to have them just kind of hold the camera, especially when we are doing the neurological component of the neurological exam component of the visit. And I'll tell you why in a little bit. Okay, all right, so on the day of the visit, log in 15 minutes prior to your visit. Position yourself in a quiet and private area. So as much as possible, you're trying to mimic an in-person clinic visit. Minimize noise, minimize distractions, turn off your TV, make sure your husband's not vacuuming in the background, make sure your dog's not barking. So as much as possible, quiet, private area. Make sure the room is well lit. That's important because some of the exam has to happen through video. Avoid eating and drinking. So just like in your in-person clinic visit, you're not eating or sipping on your coffee while you don't expect your doctor to be doing that. So we kind of maintain that environment even virtually. And then very importantly, be patient because you may encounter technical challenges like video freezing, and there may be sometimes an audio lag. But just be patient, and it's challenging even for your doctor sometime because we're still getting used to this. Again, preparation is key. Do a number of things in advance so you're logging in efficiently and quickly on the day of your visit. So during the visit, this is going to be very similar to an in-person visit. So your neurologist will typically start by confirming what we call identifying information, so such as your name and your date of birth. And if it's your first visit, be prepared to talk about a timeline of your symptoms. When did your symptoms start, and what was the first thing that you noticed, and how did things progress? So make sure you have your timeline ready. Either jot down a few points on a notepad, or just be prepared to answer those questions. Your doctor is going to ask about your other medical history. So we're interested in knowing what are your other risk factors. And so this could be, any prior history of stroke, high blood pressure, diabetes, any surgeries in the past, your response to anesthesia. So those are all important components in your medical history. Be prepared to talk about your family history. So we are looking for, again, certain risk factors, in your family history. In myasthenia gravis, in the majority of cases, it tends to be an autoimmune disease. So there may be some family history of autoimmune diseases. So you may have another family member who may not have myasthenia gravis, but may have another autoimmune disease. And that's not infrequent because autoimmune diseases tend to cluster in individuals and also tends to cluster in family members. Social history. So this is where your doctor will ask you about where you work, do you live by yourself independently? Do you have support in the house? They will ask about history of smoking, your alcohol consumption. All of that falls under social history. Current medication. So keep your list of medications and your dosages down on a piece of paper, especially if it's your new first-time evaluation. Your doctor is going to review the current medications. And even if it's not a new appointment, or even if it's a follow-up, many of us like to recheck medications to make sure that they're updated in our system. And then they will review allergies to certain medications and make sure that part of the history is also updated in our electronic system. So the history you'll feel very comfortable doing because it's very much similar to an in-person visit. But let me talk a little bit about the virtual neurological exam. So there are certain things that you can do to ensure that the virtual exam is successful and the neurologist is able to get a lot of the information that they need. So the first thing that's important is camera positioning and the light source. So when you're sitting in front of the camera, make sure the light source is in front of you and not behind you, because if the light source is behind you, it darkens your image and your face is not clearly visible, like I've demonstrated here in the left panel. But on the right side, you can see that the face is clearly visible, and that's because my nurse who volunteered to for this picture is sitting on the opposite side of the window, so she's facing the window. So that's very important. Remember, in myasthenia gravis, a large part of our neurological exam is the strength of the eyes and the face. So I really want to get a good shot of your eyes. And the full face. So your face shouldn't be hidden, and it should be well illuminated. So position your camera so such that the whole face can be seen. Make sure you're not really zoomed in all the way where I can only where only half of the face is visible. We want to see the full face because symmetry is important to see. And if you're seeing some asymmetric things on exam like droopy eyelids, etc., that can be extremely helpful for the exam. If you have a caregiver present during the virtual exam, that's incredibly helpful because they can position the camera for you. But if you're doing the video visit by yourself, there's certain tips and strategies that you can do that can help you position the camera without you needing to hold on to your phone. So here, what we did was we propped up our phone on some thick books on the table. So basically the idea is to get your camera to a fairly close to your eye level, and that will allow your neurologist to get a good picture of your full face. Be prepared to walk for your neurologist, right? So your gait assessment is an important part of the neurological exam. If you have muscle weakness and that limits your ability to walk and you're high fall risk, please make sure there's a family member available so you can do this component of the exam safely. Again, if you're by yourself, you can place your camera on a chair, for instance, and that lower level of the camera will allow sort of a larger shot of the whole body. So, your neurologist can now see you from head to toe. And in this position, we are able to do, a number of things on the neurological exam. So we can assess your gait, your ability to walk, how you walk. And then also we can do some components of the strength exam in the legs. So we might have you stand on your tippy toes or on your heels. We may ask you to stand on one foot at a time. And again, that gives us a rough estimate of the strength of different muscles in the legs. So if you have access to a scale, a weight scale, a thermometer, and a blood pressure cuff, you may be able to record your vital signs and provide them for your doctor on the day of the clinic visit. So that can be helpful if you have access to these things at home. There are several components of the neurological exam. One of them is mental status or cognition. So your neurologist will ask some questions to test your orientation, comprehension, your memory, and your language. In myasthenia gravis, the speech is frequently affected. Patients who have speech problems from MG can develop slurring of words, and they have a tendency of losing their voice over time or fatigability in their voice, which we can assess over a video visit. Eye and facial movements can be easily assessed over a video visit, but again, the key is make sure you are sitting in a well-illuminated room and your camera is positioned so we're getting a good shot of your full face. So, those are some of the things that you need to do to ensure that your neurologist can get a good neurological exam virtually. Ptosis is the droopiness of the eyelids. Again, that can be easily assessed. Sometimes when I'm talking to my MG patients, I can kind of see the fatigability of their droopy eyelids while I'm speaking to them. because it changes during the evaluation. The strength exam is, I feel, a component of the neurological exam that's limited when you're trying to do a virtual assessment. So remember, when you come to our clinic, we're checking your muscle strength by what we call confrontational testing. So you give me, you push against me. So it's your effort against my effort. But virtually that's not possible. So we have some tips to get a rough estimate of muscle strength. So for arms, what we have our patients do is that we have them raise their arms above their heads and see if they're able to, first of all, do that. And secondly, are they able to sustain that, or is there fatigability with arm elevation? Slow finger tap. So I have my patients kind of tap their fingers like this on screen. And again, you want to position your camera so that this is visible. And that gives an assessment of how weak the finger muscles are. For leg strength assessment, we talked a little bit about this during the camera positioning component of things. But one way to assess strength of the hip muscles is the ability of the patient to get up from a chair easily without using their arms. If they can do that, that suggests to me that their hip muscles are strong. Similarly, we may be able to get a sense of your trunk muscles. If you can, get up from a bed easily. We may put you through some other things like standing on one leg at a time, standing on your toes and heels. That gives us a sense of the strength of the leg muscles. Sensory exam can be performed. Again, this is a little bit limited again. But if you have a caregiver, you might be able to appreciate if there are any differences in your sensory perception of the right arm compared to the left arm. So they can simply just, rub their hands over your arm, and you can, report if you're, noticing similar sensation or if it's different, if there's a difference. So you can tell if there's a difference between left and right. But you can also kind of demonstrate and see if there's a difference between proximal or upper part of the arms and the legs, and distal, which is the lower part of the limb. Or, if there's no one available, we may simply ask you to draw a line, or, just an imaginary line around the area of numbness. Typically, sensory symptoms are not a prominent feature of myasthenia gravis. So for us, the more important component of the exam is, the exam of the face, the speech changes that we're noticing during the interview, and the strength exam of the arms and the legs. Okay, when you get to the end of your visit, keep your list of questions ready. Make sure you summarize the recommendations and plan with your neurologist at the end of your visit, so you know exactly what type of things you need to follow up on. So if there's a change in medication dosage, be clear exactly what that change is and how that change needs to occur. Are they asking you to increase your prednisone? And if they're asking you to increase the prednisone, does it have to happen in a stepwise fashion, or do they want you to change that dosage the next day? So make sure you summarize the recommendations and plan with your neurologist at the end of the visit. Make notes during the visit so you don't forget. Your doctor can e-prescribe your medication, so we can send your prescription to the pharmacy electronically. Many of you are very, comfortable with that, and, asking for refills electronically. Your doctors can also place orders for lab blood work and imaging studies. I know many of you are nervous about coming to the hospital to get blood draws and, for your x-rays and imaging studies, but there are certain regulations and precautions in place to, ensure that there is some sort of social distancing and you're not getting exposed to too many people in a room. So for instance, for blood work, in many places, you have to come by an appointment. So you can not just walk in and get labs done. So you have to call and schedule an appointment for a blood draw. And the idea behind this is that everyone doesn't come at the same time, and they're kind of spaced apart. So there are a number of precautions in place. In some cases, if you are getting home IVIG infusions, for instance, your infusion nurse may be able to draw blood for you. So in a number of my patients, I was able to do that. And that can be, extremely efficient and easy way of doing things. So, we can send your lab orders, blood work orders to your home health agency. At the end of your visit, discuss your follow-up plan and clarify with your doctor if the next visit should occur as an in-person visit, or would another virtual visit be appropriate. So advantages of telemedicine. So there are some things that we can do better with telemedicine. So remember, first of all, it's a secure platform, so your privacy is protected. The clinic visit is not being recorded, and most medical centers are using secure platforms. It definitely saves time and money because there's no commute involved in virtual visits. If you are dependent on a caregiver for transportation, there's definitely reduced dependence for these visits. And remember, you do not need to be tech savvy to conduct video visit. The technology was designed and has been designed so that anyone can use it. So it's just the if you can just get past this barrier that you can do it. It's like using FaceTime or Zoom or some other applications that you may be more comfortable with. But it's easy to do, and remember, the technology has been designed so that it's extremely user friendly. And if you require an interpreter can actually be scheduled during these video visits. So that is also a service that's available for you, and I wanted you to be aware of that. There are certain barriers to video visit. So using data from 2018, a study that was published in the medical journal JAMA, and it just came out in August of 2020. They demonstrated that almost a quarter of the Medicare beneficiaries lacked digital access at home. And this was especially true for those with low socioeconomic status, those who were 85 years and older, and in communities of color. There was another study that was again published in August in JAMA in 2020, using data from 2018. They estimated that about 38% of older individuals were not ready for video visits, predominantly owing to inexperience with technology. Telephone visits may reach more patients, but in some cases, the video adds an additional component which is missing in telephones. But even if you just think about telephone visits, there are about approximately 20% of older patients who are unready for even telephone visits because of difficulty with hearing, difficulty communicating, or dementia. Even though there are certain advantages to telemedicine, it may not be reaching everyone. All right, so lastly, I just wanted to talk to you about certain situations when an in-person visit is needed. So, hopefully I demonstrated that telemedicine is easy to do and it's effective, but in certain cases, you need to come to the clinic for an in-person evaluation. That would be if there is a significant change in your MG symptoms. So if you're noticing, if you're more symptomatic, so you have more difficulty with speech, chewing, swallowing, or vision, then it's probably best to schedule an in-person visit, because your neurologist, based on their assessment, is most likely going to recommend a change in your medications. And for that, a detailed examination is needed. Most of us prefer to see new patients for the first time in clinic. So if you're establishing care with a new provider, it's probably best to schedule an in-person visit as your first visit. And after that, if things are fairly stable, you could perhaps do a follow-up virtually. But that detailed exam would be helpful if you're establishing care with a new neurologist. Just a reminder about red flag symptoms. So if you are experiencing worsening of speech and swallowing, feeling shortness of breath with little activity and neck weakness, those are signs of potentially an MG exacerbation. And please call your clinic right away. They might schedule you for an emergent or an urgent in-person clinic visit, or in certain cases, we may have you go to the emergency room. There are, as I mentioned, special precautions in clinics and hospitals to try and reduce the spread of COVID-19. Universal masking is a criteria in hospitals, so everyone wears a mask. We're trying to keep patients apart, so social distancing in the waiting rooms. We're scheduling patients, far apart, and patients are, as they're being checked in, they are being checked in and moved to the clinic assessment rooms and not left in the waiting rooms. A lot of medical centers are asking that you come with just one family member if you need it, if you need them. If you're admitted to the hospital, there may be a no visitor policy. So just trying to reduce the number of people that are coming into the clinic space. The clinic staff is frequently disinfecting surfaces, so they're wiping down chairs and tables and trying to keep things extra clean and sanitized. And before you come in, the scheduling office will review symptoms of COVID-19 with you to ensure that you don't have any symptoms that could suggest an active infection. At the end, I just wanted to just review with you just to make sure that everyone is aware what are the common symptoms of COVID-19. This cartoon is taken from the CDC website. And so the common symptoms of COVID-19 are cough and shortness of breath or difficulty breathing, fever or chills, muscles or body aches, vomiting or diarrhea, and new loss of taste or smell. So if you have any of those, please talk to your healthcare provider. If you feel most comfortable talking to your neurologist, that's fine. We can, based on what you're reporting, we can, direct you to the right provider, and if needed, get you tested for COVID-19. In conclusion, telehealth has its advantages. The platforms are user-friendly, so it's designed so that it can be used by many of us with ease. Remember, prepare for your visit to ensure that the visit itself runs smoothly. So if it's your first time logging into an app and using an app, make sure you do that a few days in advance to ensure that your login information is correct and you know how to access your e-visit. On the day of the visit, again, be prepared with your list of questions. If it's possible for you to have a family member present, that's ideal because they can help with camera positioning. And your doctor would want to do a virtual exam, so they might have you, demonstrate your walking. So if you don't feel safe walking independently, please make sure that there's a caregiver there to provide assistance. Remember, there are certain cases where an in-person visit is needed. We talked about some case scenarios, but again, discuss with your neurologist, and at the end of the visit, especially decide if a follow-up visit needs to occur in person or would a virtual visit.
Okay, so Dr. Malik recorded that information in advance, as you can probably tell from some of the COVID numbers. She's here with us live now to answer your questions. And thank you so much, Dr. Rabia or Dr. Malik, for that excellent advice. I could tell some of it you knew just from some of the challenges you've already experienced yourself.
Great. Thank you, Joan and Conquer MG, for inviting me to do this special webinar on telemedicine. I too miss looking at faces and, being around people and talking to them in person. This is, still a little bit challenging, and I do miss the human connection. So we saw this exponential increase in video visits in March and in April. And since this is such a new way of providing and getting health, there was a learning process both for the physicians and the patients. But I think many of us are now getting more comfortable with video visits and, have come to realize that in some ways this is a great tool, and, maybe it should be continued even after the pandemic is over.
Cool, that's exciting, especially to avoid some of that commuting to the to clinic locations. Well, let's get started with the questions then. You had a couple that you received ahead of time.
Right, so I apologize for the train that's passing by my clinic here. The number of really good questions. So the first one was, what special challenges do patients with MG face during telemedicine visit? And that's sort of an excellent question. And so I would think that some of the challenges that are specific to the MG population would be related to their symptoms, really, right? So the weakness of voice or speech may make communication difficult, especially if that, evaluation is occurring over the phone. And weakness of legs may make it challenging for patients to demonstrate their gait safely. So for a number of reasons, an MG patient may not be able to participate in a virtual visit independently and may require the assistance of a caregiver. Remember, a number of our MG patients are older, so we hear about this bimodal peak where it affects young women and older men, but most of our MG patients tend to be in the older age group, so their symptoms start after the age of 50, and they may have other non-MG limitations, so such as a difficulty with hearing or seeing, and that may be something that can contribute to challenges in completing a telemedicine visit.
Great. Any other questions that you got?
Right. So there's another good question here about can telemedicine replace the physical exam my neuromuscular specialist would give me? And so I touched on this a little bit during the presentation as well, but your neurologist is able to assess a number of things on the exam like we discussed. We talked about the facial exam, the eye exam, the speech, and your gait and such. Of course, the amount of information that your provider can get really depends on your connection and how effective your visit was, and how the quality of your video as well. Subtle weakness of muscles and changes in strength may be difficult to assess on the video. So there are some limitations, and so in those situations an in-person visit may be required, and especially if you feel like your MG symptoms are not stable and your neurologist is in the process of adjusting your medications, an in-person visit would be preferred. So Joan, I have another really good question, and we, kind of again discuss some of these things, but I think it's important to go over this, and that is how can we prepare information in a more effective way to get better results? As discussed, so there are a number of things you want to do prior to your visit. So there, I would say four big things. So remember to log in prior to your visit to ensure that there are no issues with your internet connection and your login information. So that's important. Keep a list of your current medications and dosages handy. That's really important. So either keep your pill boxes or your pill bottles in front of you, or just write them down on a piece of paper. Keep notes of your MG symptoms because it's possible you might forget on the day off. So just keep a diary or keep your notes ready with regards to your MG symptoms. or any other changes in your health. So if there was a change in your blood pressure medication, for instance, or if you had fever, etc. recently, that information is helpful. And then the fourth one is make a list of your questions. So, if you have any specific questions with regards to your MG care, make that list of questions in advance of your visit. So those would be the four sort of things that you need to do prior to your visit. After or towards the end of your visit, there's some additional things that you would that you should be doing. Write down the recommendations. So sometimes it's difficult after a virtual visit to send you an after visit summary. Virtually, it might not get to you. When you're in clinic, you go home with a piece of paper, right, with all your instructions, but you may not get that after a video visit. So write down the recommendations from your doctor if there were any medication adjustments and changes. Make sure you're getting your orders for your blood work and all your refills done. Review your recommendations, so very, very important. Just have your neurologist go over and make sure that you are reviewing them, reviewing the right instructions and going over all the things, and making sure that you're not missing anything, and discuss follow-up plan. So those would be some of the things that I would recommend to make sure that you've had an effective and an efficient visit. So there is a question about how do you communicate on a regular phone about things that really should be seen. So it's difficult, and certainly video and in-person visits are better. But your neurologist can get some understanding of the extent of your symptoms by how it affects your activities of daily living. So there is a scale that we use in clinic and also in research. Is called the MG-ADL scale. Activities of daily living scale, and we're kind of assessing how your MG is impacting your ability to speak, for instance, to swallow, get up from a chair, etc. And that can give us some information about the status of your MG. We may be able to assess maybe the quality of your voice over the phone, but this type of assessment is certainly limited, and it's more subjective because we're relying on your report. And that objective piece of information is missing because we're not getting the examination that we would get maybe during a video visit, and then of course in person when we're doing that motor exam with the strength test. So again, if you feel like your symptoms are not stable, you're noticing more MG symptoms, or your neurologist is in the process of adjusting your medications, sometimes an in-person visit is helpful. So there's a question about what do you do when you feel your neurologist isn't taking your concerns seriously? And I think this is not just an issue that's limited to virtual care, right? So sometimes even in-person clinic, sometimes you feel maybe the appointment was rushed and you felt like your questions were not answered. So I think the best thing you can do is talk to your neurologist about this. And it helps if you're very specific about your problems and questions, right? So don't be vague. Give lots of examples. Tell your doctor how a certain symptom affects your activities. So it's really helpful for me to know that you get winded when you walk a block, right? Versus just saying that, I feel like my breathing is heavy or my chest is heavy. So if you give me something, a specific example of how it affects your function, that's really helpful for the neurologist, and they might be able to better answer your question. And I think that's sort of an important take-home message. So this is not related to telemedicine, Joan, directly, but I'm going to answer this question because I think it's an important question. How many people with MG have had COVID-19, and how have those people recovered, or how many have died? So before we started this webinar, Joan and I were talking how there are a number of efforts nationally and internationally to collect information about how this infection is impacting myasthenia gravis patients. There are some guidelines, and a number of experts have come out, and they have said that MG patients are considered high-risk patients, okay? And for that is true for a number of reasons. One of them is there is a risk of MG exacerbation, just like with any other infection. So with COVID-19, we were also worried that there may be an MG exacerbation with this infection. The second is that it's a disease that affects the lung, and in some MG patients there may be restriction in lung function from the myasthenia gravis, so they're at a higher risk for complications from that. And then the third is, of course, the medications that you may be taking are what we call immunosuppressive medications, right? So the way the medications help with myasthenia gravis is that they either suppress the immune system or modulate the immune system. And thymectomy also may kind of, put you at high risk of infections. So for all of those reasons, we do feel that MG patients are sort of the high risk patients. And there are efforts nationally and internationally to collect information about how this pandemic is affecting MG patients. There is a CARE MG registry that I'm aware of. And so far, I looked at it before I started this presentation, and they've reported about 85 MG patients with confirmed infections or either confirmed COVID-19 or suspected infection. And they have reported about 22 deaths. Anecdotally, here at Rush, we follow about 200 patients with MG. And so far, we've had about maybe 3 hospital admissions for MG patients in the setting of COVID-19 related problems. All 3 of these patients did well. One of the patients was in the ICU for a long period of time, but they were discharged, and I just spoke to them yesterday, and they're home and they're doing well. So there are a handful of cases that have been reported. Overall, at least based on what I've seen, thankfully we haven't seen any increased mortality in MG patients. So that's the information that I have at this time to share with you all. The last question, which I think is also a very good, important question, and I think we should discuss this, every opportunity we have, and that is, should I get the flu shot and the shingle vaccine? And the answer is yes, you should. It is recommended for myasthenia gravis patients to get the annual influenza vaccination. You just have to ensure that the vaccination is the inactive form of vaccine, and the same is true for the shingles vaccine. As long as it's the inactive form of the vaccine, it's safe for MG patients. We just want you to avoid live vaccines. I think that's all that I have, Joan, and I don't know if you're seeing more questions at your end.
Yeah, I've got a couple more. And this one, this person asks that he's newly diagnosed, and he's wanting to know how treatment and confirmation can be made without testing the reflexes. But the important thing that he or she asks is, especially when symptoms are intermittent. Sometimes I know we've suggested to people to try and make your appointment later in the day if that's when your symptoms come up. But what advice do you have for that?
Right. So it's helpful for us to actually see you when you're at your worst, right? Because that gives us a lot of information. Sometimes it might be helpful for you to take pictures. So I do ask my patients, to take pictures of their eyes, especially if they are noticing a lot of droopiness of the eyelids. Or make videos if you notice that there are certain times of the day when you're kind of not walking very well. Have a caregiver make videos. But remember, for us, when it comes to diagnosis of myasthenia gravis, aside from the history and the clinical exam, there are a number of diagnostic testing that we do to confirm MG. So there's the antibody testing and the single fiber EMG testing. So even if you did not have symptoms, those blood tests and those EMG studies should be able to confirm the diagnosis. So even though it's a fluctuating disease, we should be able to diagnose you even if you are completely symptom-free from myasthenia gravis. And I hope that answered that question.
Okay. And let's see, I think you answered this. What kind of information can I be collecting on my own to help the doctor understand how I'm feeling instead of more tired. I mean, I'm remembering it seemed helpful when I could tell my doctor years ago, okay, I need 2 hands to get a jar of pickles out of the fridge compared to, I used to be able to do that, or, some concrete image, right? That's
right, exactly right. So give us specific examples of how your activities are changing, or what are you noticing? So one of my patients that I just spoke to this morning, exercises very regularly, and when he was first diagnosed, he noticed his ability to exercise decline. So he could do 30 push-ups, and then he got to the point where he could not even do 1 push-up. And so when we hear that, that's sort of like such a great specific example, and it catches our attention when we know that there is something we need to investigate and look into here. So give specific examples, make notes, make a sort of a symptom diary, and then again, kind of have that checklist handy when you're talking to your doctor.
great. Okay. Let's see. And then I just got one more question. How often, and this I think is related to telemedicine, how often does one normally see the doctor? And with MG, it slowly progresses, so it's difficult to know at what point to make that appointment.
Right. So it's different for different individuals. So it really depends on your disease, right? So each MG is different. It's the snowflake disease, right? So on average, we kind of see you at least every 3 months or so, I would say. But in patients who are extremely symptomatic or new into their disease, or they are in the process of getting their medications adjusted, it may be as frequent as monthly check-ins with your doctors. With regards to video versus in-person, we kind of talked about it a little bit. If your disease is stable, then a video visit is sufficient, because we're just kind of going over your symptoms and making sure that there's nothing that's that has changed, and your medications are also kind of at the same dosages. Then a video visit is definitely appropriate, and it's effective. But your doctor may be able to guide you better if an in-person visit is required.
Great, great. Okay, you know what? I think that's about it then in terms of questions. I think it's time to wrap up. So thank you once again, Dr. Malik, for sharing your expertise. It's been great. And thank everyone who's been able to attend this afternoon too, and who will be looking at this in the future. Let's see. So if you appreciated this information, please know that we'd appreciate your support at Conquer MG. And one last note, if you'd like more information about myasthenia gravis, or if you'd like to donate, please visit our website at www.myastheniagravis.org. Thanks a lot.